So we're now in a position to start planning this patient. And if we look at the volumes we're wanting to plan, what I'm going to do is just turn off some structures. And I just want to have a look at my GTV and PTV to start off with. And as I scroll up and down, I can just move these marks out, these lines out of the way. And let me just zoom in on the patient. There we go. So you can see here that the prostate and seminal vesicles have been contoured as the GTV, and then let me just turn off those points as well so we can see a bit clearer. And then we've added a margin of 1 centimetre in all directions, other than the post border, and the post border is 0.8 centimetres, so a little bit less. But if we were to turn the rectum on, we can see that the rectum is actually going up into the prostate, into the PTV, should I say. So we are going to deliver some dose to the prostate, to the rectum. So remember, we need to give this area here 95 to 107, and so that means that this area here is going to get 95 to 107. We can see these in a few different views. So one view that can be quite helpful, if we scroll across into this sagittal plane and make that bigger. If we scroll backwards and forwards now, it allows us to get a view of how much of the rectum is actually inside the PTV. So you can see this patient's got some kind of changes within the rectum. It's not quite symmetrical, but again, it's a rectum that's certainly plannable. And we've planned, and the rectum's been contoured from the anus up until this rectosigmoid junction, just as the rectum starts to move forward. So the first thing we need to do is insert a new plan for this patient and a new course. So we're going to go planning, and in fact we're going to go insert, and we're going to go new course, and let's call the course whatever your name is. So I'm going to put Mark, and that way when I come back to my patient, I'm going to remember what my patient is. And then we're going to go into insert again, and we're going to do a new plan. So we're doing a new plan, and the course is course Mark, and then we're ready to import that. So we're going to say the volume that we're wanting to target is the PTV, and click yes to that. And then if we were doing some IMRT planning, then what we would do is insert some parameters there, but we're not in this session, so we're going to leave those blank. So we can click OK again, and then primary reference point is going to be in the PTV. Next. So essentially we can just keep clicking next to these, and the patient is laid head first supine, which is pretty important. Obviously the patient was the other way around, and the little man changes to tell us that we're in the right direction. We're going to go head first supine, and then that's our plan imported. So we can set a name for the plan. So I might call this, I'm going to call this, I don't know, a 3-field plan. So I'm just going to use 3 fields to demo what to do on this patient. And then the other thing that I want to do is we need to tell it how much dose. So we're going to give it the patient 37 fractions, and we're going to give it the patient 2.05 gray per day, and so which adds up to 76, or just under. Obviously if that number came wrong, then that would spot it out. The easy thing to do is this, so we could do 76 in 37, which is the common way we're used to kind of writing things down, and if we do that we can see we're giving the patient nearly 3000 gray, so that kind of hopefully highlights that to us. So 2.05. The LINAC we're going to use is the Shu Varian 1 LINAC, and we're going to click OK, and we're going to call our first beam an anterior beam, or ANT, and I'm going to use 10 MV, so 10x. So X is X-rays, i.e. photons, E is electrons, so 10 MV. We'll leave the dose rate as it is, and I'm going to click OK, and as we can see now, it's now imported a beam, an anterior beam. We can see it on the display there, we can see this field exists down there, and we can also see the parameters of the beam down here, and we can change them in a few different ways, which I'll show you in the next video.